Creating effective point combinations in acupuncture involves both art and science. The goal is to harmonize the body's energy, chi, address root cause, ben, and symptoms, biao, and tailor treatment to each individual. First, we will discuss about treating cause and effect. Disease tend to have one or more underlying cause, ben, and one or more external manifestation, biao. For example, a common cold may have underlying deficiency of Qi, Ben, with outward signs of exterior wind, Biao. Example, sneezing and chills. The underlying deficiency of Qi, the cause, allows the invasion of exterior wind, the effect. The question in forming a point combination is when to treat the cause and when to treat the effect. There are various possibilities. Number 1, treat effect only. Number 2, treat cause only. Number 3, treat cause then effect. Number 4, treat effect then cause. And number 5, treat cause and effect simultaneously. First, we will discuss about treat effect only. This is usually only done when the effect is exterior and is dominant to the cause. For example, when there is wind cold invasion with only mild underlying deficiency of Qi, so that this deficiency will be corrected by the body itself without further treatment once the exterior wind cold has been expelled. Example, with lung 7 and Li4 acupuncture point. In my 22 years of clinical experience, most of my patients have had chronic underlying deficiencies which needed tonifying after the exterior factor was removed. If both cause and effect are interior, it is more common to treat them successively or simultaneously rather than treat the effect only. For example, if there is insomnia from deficient HERT-3, Anmian for insomnia can be used at the same time as HERT3 for deficient HERT-3. Number 2, when we are treating cause only, we have to exclude external conditions since the external factor must be expelled first. It may be important in some internal problems to treat the root only. For example, CV4, stomach 36, kidney 3. For an underlying condition of deficient kidney yang may relieve the symptoms of tiredness and impotency. Number 3, treating cause then effect is rare in external conditions since the external factor is usually expelled first. It is also uncommon in internal conditions since the internal cause and internal effect are often treated together. Number 5, treating effect then cause is very common for illnesses when there is a chronic internal condition with occasional more severe aggravations, and also for illnesses where the effect is so urgent it must be dealt with immediately.